Hello, I am Dr. Lilia, an academic. In this video, we will delve into heart attack, a sensitive topic for many, with detailed analysis. Welcome to my video, where you will find the most comprehensive and in-depth information available on YouTube about heart attack, including its diagnosis and treatment methods. Please make sure to watch the entire video. 1. Heart attack, myocardial infarction. One cannot overemphasize the importance of seeking prompt medical attention in the presence of new symptoms that suggest a heart attack. Early diagnosis and treatment save lives, and delays in reaching medical assistance can be fatal. A heart attack results when a blood clot completely obstructs a coronary artery supplying blood to the heart muscle and heart muscle dies. The blood clot that causes the heart attack usually forms at the site of rupture of an atherosclerotic cholesterol plaque on the inner wall of a coronary artery. The most common symptom of heart attack is chest pain. The most common complications of a heart attack are heart failure and ventricular fibrillation. The risk factors for atherosclerosis and heart attack include elevated cholesterol levels, increased blood pressure, tobacco use, diabetes, male gender, and a family history of heart attacks at an early age. Heart attacks are diagnosed with electrocardiograms and the measurement of cardiac enzymes in the blood. Treatment guidelines emphasize treatment at a hospital capable of doing PCI, percutaneous coronary intervention, also termed as stenting or stent placement. The early reopening of blocked coronary arteries reduces the amount of damage to the heart and improves the prognosis for a heart attack. Medical treatment for heart attacks may include antiplatelet, anticoagulant, and clot-dissolving drugs as well as angiotensin-converting enzyme, ACE, inhibitors, beta blockers, and oxygen. Interventional treatment for heart attacks may include coronary angiography with percutaneous transluminal coronary angioplasty, PTCA, coronary artery stents, and coronary artery bypass grafting, CABG. Patients suffering a heart attack are hospitalized for several days to detect heart rhythm disturbances, shortness of breath, and chest pain. Further heart attacks can be prevented by aspirin, beta blockers, ACE inhibitors, discontinuing smoking, weight reduction, exercise, good control of blood pressure and diabetes. Following low cholesterol and low saturated fat diet that is high in omega-3 fatty acids, taking multivitamins with an increased amount of folic acid, decreasing LDL cholesterol, and increasing HDL cholesterol. 2. What is a heart attack? A heart attack, also known as a myocardial infarction or MI, is the damage and death of heart muscle from the sudden blockage of a coronary artery by a blood clot. Coronary arteries are blood vessels that supply the heart muscle with blood and oxygen. Blockage of a coronary artery deprives the heart muscle of blood and oxygen, causing injury to the heart muscle. Injury to the heart muscle causes chest pain and chest pressure sensation. If blood flow is not restored to the heart muscle within 20 to 40 minutes, irreversible death of the heart muscle will begin to occur. Muscle continues to die for 6 to 8 hours, at which time the heart attack usually is complete. The dead heart muscle is eventually replaced by scar tissue. 3. What causes a heart attack? 4. Atherosclerosis. Atherosclerosis is a gradual process by which plaques, collections of cholesterol, are deposited in the walls of arteries. Cholesterol plaques cause the hardening of the arterial walls and narrowing of the inner channel, lumen, of the artery. Arteries that are narrowed by atherosclerosis cannot deliver enough blood to maintain the normal function of the parts of the body they supply. For example, atherosclerosis of the arteries in the legs causes reduced blood flow to the legs. Reduced blood flow to the legs can lead to pain in the legs while walking or exercising, leg ulcers, or a delay in the healing of wounds to the legs. Atherosclerosis of the arteries that furnish blood to the brain can lead to vascular dementia, mental deterioration due to gradual death of brain tissue over many years, or stroke, sudden damage and death of brain tissue. In many people, atherosclerosis can remain silent, causing no symptoms or health problems, for years or decades. Atherosclerosis can begin as early as the teenage years, but symptoms or health problems usually do not arise until later in adulthood when the arterial narrowing becomes severe. Smoking cigarettes, high blood pressure, elevated cholesterol, and diabetes mellitus can accelerate atherosclerosis and lead to the earlier onset of symptoms and complications, particularly in those people who have a family history of early atherosclerosis. Coronary atherosclerosis, or coronary artery disease, refers to the atherosclerosis that causes hardening and narrowing of the coronary arteries. Diseases caused by the reduced blood supply to the heart muscle from coronary atherosclerosis are called coronary heart diseases, CHD. Coronary heart diseases include heart attacks, sudden unexpected death, chest pain, angina, abnormal heart rhythms, and heart failure due to weakening of the heart muscle. 5. Atherosclerosis and angina pectoris. Angina pectoris, also referred to as angina, is chest pain or pressure that occurs when the blood and oxygen supply to the heart muscle cannot keep up with the needs of the muscle. When coronary arteries are narrowed by more than 50 to 70%, the arteries may not be able to increase the supply of blood to the heart muscle during exercise or other periods of high demand for oxygen. An insufficient supply of oxygen to the heart muscle causes angina. Angina that occurs with exercise or exertion is called exertional angina. In some patients, especially in people with diabetes, the progressive decrease in blood flow to the heart may occur without any pain or with just shortness of breath or unusually early fatigue. Exertional angina usually feels like a pressure, heaviness, squeezing, or aching across the chest. This pain may travel to the neck, jaw, arms, back, or even the teeth, and may be accompanied by shortness of breath, nausea, or a cold sweat. Exertional angina typically lasts from 1 to 15 minutes and usually is relieved by rest or by placing a tablet of nitroglycerin under the tongue. Both resting and nitroglycerin decrease the heart muscle's demand for oxygen, thus relieving angina. Exertional angina may be the first warning sign of advanced coronary artery disease. Chest pains that just last a few seconds rarely are due to coronary artery disease. Angina also can occur at rest. Angina at rest more commonly indicates that a coronary artery has narrowed to such a critical degree that the heart is not receiving enough oxygen even at rest. Angina at rest infrequently may be due to the spasm of a coronary artery, a condition called Prinzmetal's or variant angina. Unlike a heart attack, there is no permanent muscle damage with either exertional or rest angina, although the angina is a warning sign that there is an increased chance of a heart attack in the future. 6. Atherosclerosis and heart attack. Occasionally the surface of a cholesterol plaque in a coronary artery may rupture and a blood clot forms on the surface of the plaque. The clot blocks the flow of blood through the artery and results in a heart attack. The cause of rupture that leads to the formation of a clot is largely unknown, but contributing factors may include cigarette smoking or other nicotine exposure, elevated low-density lipoprotein, LDL, cholesterol, elevated levels of blood catecholamines, adrenaline, high blood pressure, and other mechanical and biochemical stimuli. Unlike exertional or rest angina, heart muscle dies during a heart attack and loss of the muscle is permanent. Unless blood flow can be promptly restored, usually within 1 to 6 hours. While heart attacks can occur at any time, more heart attacks occur between 4 a.m. and 10 a.m. because of the higher blood levels of adrenaline released from the adrenal glands during the morning hours. Increased adrenaline, as previously discussed, may contribute to the rupture of cholesterol plaques. Only half of the patients who develop heart attacks have warning signs such as exertional angina or rest angina prior to their heart attacks, but these signs may be mild and ignored as unimportant. 7. What are the symptoms of a heart attack? Although chest pain or pressure is the most common symptom of a heart attack victims may experience a variety of conditions including pain, fullness and/or squeezing sensation of the chest, jaw pain, toothache, headache, shortness of breath, nausea, vomiting, and/or general epigastric, upper middle abdomen, discomfort, sweating, heartburn and/or indigestion, arm pain, more commonly the left arm, but may be either arm, upper back pain, general malaise, vague feeling of illness, No symptoms. Approximately 1/4 of all heart attacks are silent, without chest pain or new symptoms. Silent heart attacks are especially common among patients with diabetes mellitus. Even though the symptoms of a heart attack at times can be vague and mild, it is important to remember that heart attacks producing no symptoms or only mild symptoms can be just as serious and life-threatening as heart attacks that cause severe chest pain. Too often patients attribute heart attack symptoms to indigestion, fatigue, or stress, and consequently delay seeking prompt medical attention. One cannot overemphasize the importance of seeking prompt medical attention in the presence of new symptoms that suggest a heart attack. Early diagnosis and treatment saves lives, and delays in reaching medical assistance can be fatal. A delay in treatment can lead to permanently reduced function of the heart due to more extensive damage to the heart muscle. Death also may occur as a result of the sudden onset of arrhythmias such as ventricular fibrillation. 8. What are the complications of a heart attack? 9. Heart failure. When a large amount of heart muscle dies, the ability of the heart to pump blood to the rest of the body is diminished, and this can result in heart failure. The body retains fluid, and organs, for example, the kidneys, begin to fail. 10. Ventricular fibrillation. Injury to heart muscle also can lead to ventricular fibrillation. Ventricular fibrillation occurs when the normal, regular, electrical activation of heart muscle contraction is replaced by chaotic electrical activity that causes the heart to stop beating and pumping blood to the brain and other parts of the body. Permanent brain damage and death can occur unless the flow of blood to the brain is restored within 5 minutes. Most of the deaths from heart attacks are caused by ventricular fibrillation of the heart that occurs before the victim of the heart attack can reach an emergency room. Those who reach the emergency room have an excellent prognosis. Survival from a heart attack with modern treatment should exceed 90%. The 1% to 10% of heart attack victims who later die frequently had suffered major damage to the heart muscle initially or additional damage at a later time. Deaths from ventricular fibrillation can be avoided by cardiopulmonary resuscitation, CPR, started within 5 minutes of the onset of ventricular fibrillation. CPR requires breathing for the victim and applying external compression to the chest to squeeze the heart and force it to pump blood. In 2008, the American Heart Association modified the mouth-to-mouth instruction of CPR and recommends that chest compressions alone are effective if a bystander is reluctant to do mouth-to-mouth. When paramedics arrive, medications and/or an electrical shock, cardioversion, can be administered to convert ventricular fibrillation back to a normal heart rhythm and allow the heart to pump blood normally. Therefore, prompt CPR and a rapid response by paramedics can improve the chances of survival from a heart attack. In addition, many public venues now have automatic external defibrillators, AEDs, that provide the electrical shock needed to restore a normal heart rhythm even before the paramedics arrive. This greatly improves the chances of survival. 11. What are the risk factors for atherosclerosis and heart attack? Factors that increase the risk of developing atherosclerosis and heart attacks include increased blood cholesterol, high blood pressure, use of tobacco, diabetes mellitus, male gender, and a family history of coronary heart disease. While family history and male gender are genetically determined, the other risk factors can be modified through changes in lifestyle and medications. High blood cholesterol, hyperlipidemia. A high level of cholesterol in the blood is associated with an increased heart attack risk because cholesterol is the major component of the plaques deposited in arterial walls. Cholesterol, like oil, cannot dissolve in the blood unless it is combined with special proteins called lipoproteins. Without combining with lipoproteins, cholesterol in the blood would turn into a solid substance. The cholesterol in blood is either combined with lipoproteins as very low-density lipoproteins, VLDL, low-density lipoproteins, LDL, or high-density lipoproteins, HDL. The cholesterol that is combined with low-density lipoproteins, LDL cholesterol, is the bad cholesterol that deposits cholesterol in arterial plaques. Thus, elevated levels of LDL cholesterol are associated with an increased risk of heart attack. The cholesterol that is combined with HDL, HDL cholesterol is the good cholesterol that removes cholesterol from arterial plaques. Thus, low levels of HDL cholesterol are associated with an increased risk of heart attacks. Measures that lower LDL cholesterol and/or increase HDL cholesterol, losing excess weight. Diets low in saturated fats, regular exercise, and medications have been shown to lower the risk of heart attack. One important class of medications for treating elevated cholesterol levels, the statins, have actions in addition to lowering LDL cholesterol which also protect against heart attack. Most patients at high risk for a heart attack should be on a statin no matter what the levels of their cholesterol. High blood pressure, hypertension. High blood pressure is a risk factor for developing atherosclerosis and heart attack. Both high systolic pressure, the blood pressure as the heart contracts, and high diastolic pressure, the blood pressure as the heart relaxes, increase the risk of heart attack. It has been shown that controlling hypertension with medications can reduce the risk of heart attack. Tobacco use, smoking. Tobacco and tobacco smoke contain chemicals that cause damage to blood vessel walls, accelerate the development of atherosclerosis, and increase the risk of heart attack. Diabetes mellitus. Both insulin-dependent and non-insulin-dependent diabetes mellitus, type 1 and 2, respectively, are associated with accelerated atherosclerosis throughout the body. Therefore, patients with diabetes mellitus are at higher risk for reduced blood flow to the legs, coronary heart disease, erectile dysfunction, and strokes at an earlier age than non-diabetic subjects. Patients with diabetes can lower their risk through rigorous control of their blood sugar levels, regular exercise, weight control, and proper diets. Male gender. Men are more likely to suffer heart attacks than women if they are less than 75 years old. Above age 75, women are as likely as men to have heart attacks. Family history of heart disease. Individuals with a family history of coronary heart diseases have an increased risk of heart attack. Specifically, the risk is higher if there is a family history of early coronary heart disease, including a heart attack or sudden death before age 55 in the father or other first-degree male relative, or before age 65 in the mother or other female first-degree female relative. 12. How to diagnose a heart attack. When there is severe chest pain, suspicion that a heart attack is occurring usually is high, and tests can be performed quickly that will confirm the heart attack. A problem arises, however, when the symptoms of a heart attack do not include chest pain. A heart attack may not be suspected, and the appropriate tests may not be performed. Therefore, the initial step in diagnosing a heart attack is to be suspicious that one has occurred so that the appropriate tests can be done. Electrocardiogram. An electrocardiogram, ECG, is a recording of the electrical activity of the heart. Abnormalities in the electrical activity usually occur with heart attacks and can identify the areas of heart muscle that are deprived of oxygen and/or areas of muscle that have died. In a patient with typical symptoms of heart attack, such as crushing chest pain, and characteristic changes of heart attack on the ECG, a secure diagnosis of heart attack can be made quickly in the emergency room and treatment can be started immediately. If a patient's symptoms are vague or atypical and if there are pre-existing ECG abnormalities, for example, from old heart attacks or abnormal electrical patterns that make interpretation of the ECG difficult, the diagnosis of a heart attack may be less secure. In these patients, the diagnosis can be made only hours later through blood tests. Cardiac enzymes are proteins that are released into the blood by dying heart muscles. These cardiac enzymes are creatine phosphokinase, CPK, special subfractions of CPK, specifically, the MB fraction of CPK, and troponin, and their levels can be measured in blood. These cardiac enzymes typically are elevated in the blood several hours after the onset of a heart attack. Currently, troponin levels are considered the preferred lab tests to use to help diagnose a heart attack, as they are indicators of cardiac muscle injury or death. A series of blood tests for the enzymes performed over a 24-hour period are useful not only in confirming the diagnosis of heart attack, but the changes in their levels over time also correlates with the amount of heart muscle that has died. The most important factor in diagnosing and treating a heart attack is prompt medical attention. Rapid evaluation allows early treatment of potentially life-threatening abnormal rhythms such as ventricular fibrillation and allows early reperfusion, return of blood flow to the heart muscle, by procedures that unclog the blocked coronary arteries. The more rapidly blood flow is re-established, the more heart muscle that is saved. At this time, mechanical reperfusion with angioplasty and/or stenting to increase the flow of blood to the heart is the preferred way to preserve heart muscle if it can be performed within 90 minutes of arrival to the hospital. If there will be a delay, thrombolytic agents, clotbusters, are preferred. Large and active medical centers often have a chest pain unit where patients suspected of having heart attacks are rapidly evaluated. If a heart attack is diagnosed, prompt therapy is initiated. If the diagnosis of heart attack is initially unclear, the patient is placed under continuous monitoring until the results of further testing are available. 13. What is the treatment for heart attack? The American College of Cardiology Foundation, ACCF, and the American Heart Association, AHA, Task Force recommends a treatment guideline that they consider as a preferred strategy to treat heart attacks. PCI, percutaneous coronary intervention, or stenting is emphasized. The 2013 ACCF-AHA guidelines for treatment of a heart attack are summarized as follows. Ideally, transport patient to a PCI-capable hospital. If not PCI-capable, transfer patient as soon as possible in less than 120 minutes. If anticipated transfer is more than 120 minutes, give fibrinolytic agent within 30 minutes of arrival. Send to cath lab. Diagnostic angiogram. PCI, percutaneous coronary intervention, also termed stenting or stent placement. If reocclusion occurs or perfusion fails in a patient given a fibrinolytic, arrange transfer to a PCI-capable facility. For other patients treated with a fibrinolytic, transfer to a PCI facility within about 3 to 24 hours. If Step 5 occurs, Step 3 should follow at a PCI-capable facility where either medical therapy, a PCI or a CABG should be done. Patients who are not candidates for PCI therapy usually undergo medical or surgical, CABG, therapy. Thank you for watching today's video. If you enjoy content like this, please don't forget to subscribe to my channel and click on the notification bell to stay updated with new videos. Also, if you liked it, be sure to leave a like and share your thoughts in the comments. Looking forward to seeing you again with new videos. I can't wait to bring you more knowledge from the enchanting world of science.